Um, Hi, my name is Sukhjinder Kaur, and now I'm explaining my presentation about development and information about FASD, and so which is a part of card programming education assistant. So let's start my presentation now. Um, which is include agenda. So understanding FASD. So what is a FASD definitions? FASD in Alberta and Canada. So FASD identifications, FASD prevention, physically characteristic of FASD. So general information about FASD. So what schools should know? Treatment and support, local resource, Central Alberta FASD network. So who this is for reference. So now I explain physics number third, understanding FASD. So title, what is the FASD? Guide family, educator and community members. So subtitle, promoting the children elementary school age living with the FASD. So now I explain physics number four, what is FASD definition? So fatal alcohol separator disorder, lifelong disabling condition, which is a result of a parental alcohol exposure. So it influences the behavior or development, brain development, physically growth and learning. So there is no such thinking typically to person. So with the FASD, some need to be help in one or two, some in several area. So what is intriguing? So for FASD is commonly asthma, cerebral palsy, and Down syndrome combined. So I explain as is phases number five, FASD in Alberta and Canada. So about 4% Canada individually have FASD, approximately 1.45 million. So potentially 174,000 person in Alberta are in the infected area. So majority of the individuals, young people who live up to serve have a prevention 1.2%. So cost of FASD to Canadian economic is close to $9.7 billion every year. So let us explain physics number six. So FASD identification. There are doctor, physiologist, and the speech language pathologist utilized as the practitioners in diagnosis produce. So attempt to observe facial appearance development, neurodevelopment, and alcohol expose. So diagnosis is completed and it can do here. So I explained phases number seven, FASD prevention. So prevention of FASD could only be carried out through avoiding alcohol before and during pregnancy. Canada emphasizes led on educate the use of drug, alcohol, pregnancy education. So benefiting of the vulnerable women. So resource to promote health and preventing potentially. So Alberta warning sign are used in liquor store and commonly programs. So now I explain phases number eight. So physically characteristic of FASD. Usually characteristic near 10 and 15% upper lip, so smooth filter, pin size isole, other signs, weak body weight, so underdevelopment head size. So kidney problem. Hmm. So now I explain visit number nine. Generally information about FASD. Inference thinking about behavior and physically functioning. So issue that may involve our fox, memory, impulse regulation, expressive language delay, SCI learning. So a lot in visually with the FASD are strong also. So visual learning, empathy, creativity. So assistance should be individuality. So now I explain phases number 10, what school should know. So educator play major role in assisting student with FSD. So helpful strangers have brief direct command, take assistant of visually tools such as checklist or schedules. So feedback frequently. So make routine productive, produce exercise and rest. So um, I explain in pages number 11, treatment and sport. So FAST can never be cured, but early treatment can do a lot. Support includes mental health care, physically, occupationally therapy. So Alberta School WRAP 2.0 program. So website. So now I explain pages number 12 local resources. Central and the Alberta FAST network diagnoses family sports, school coaching, culture, strength-based programs. So assistance is preventing the stigma and community confidence creation. So now I explain page number 13. Who this is for? This flyer is to family educator member of community. So created as a resource to parents, guidance, elementary school age children with FSD. So use of easy language, so helpful tips and local resource involved. So now this is our reference that used about my presentations. So thank you so much. Okay, bye bye.